So if you feel that Medicare is confusing, just a bunch of jumbled different letters, A, B, C, and apparently there's also letters N, I'm here to tell you you're not alone. There is only 4 parts to Medicare, and that is parts A, B, C, and D. Welcome to Medicare Uncomplicated. My name is Sebastian Correa. I am a local health insurance broker, and I'm here to really talk about all the different parts of Medicare and explain what each one means and what it means to you. I have a client, and one of the things she did, her name is Leah, she retired, enrolled in Medicare Part A and B automatically after retiring, and was in fantastic health. Went to see the doctor once a year, took 0 medications, and at the age of 75, she had an accident and had to go to the hospital. When she got out of the hospital, she thought her health care with A and B was all taken care of, and it wasn't. Lots of bills came through, called me for help, and realized that when I was trying to help her get additional insurance that she didn't realize she needed to get, she had nothing but penalties and fines. So Part A covers your hospital. So Part A, think of it of like 4 walls of a hospital. Anytime you're like in a 4-wall building, that's Part A. So that's gonna be your hospital insurance. If you're in home health, it counts as well, hospice and skilled nursing facility. Now Part B is your doctor visits, your specialist visits, your labs. There's a slew of different services offered in Part B, including like not self-administered prescriptions, but typically that is what both A and B together is what they consider traditional Medicare. They also call it just original Medicare, so those terms are interchangeable. What's unique about this is most people think you get Part A, you get Part B, you get your red, white, and blue card, and it has Part A and B, and they think they have medical coverage. And I'm here to tell you that they don't. So Medicare is responsible for 80% of all medical services. You're responsible for 20%. And this is why somebody like Leah got such a surprise bill, not knowing that that wasn't covered and there's expenses there. I have an example I give a lot of clients where, let's just assume you have a $100,000 accident. If you just have Medicare A and B, Medicare is gonna cover $80,000 or 80% of that. You're now responsible for that $20,000. And that's still a lot of gap. You have a lot of risk there, a lot of gap. I mean, some people, let's say that accident's much more. That's running through their entire savings potentially, or their month-to-month income. I tell people they do have options of what they should do when they're first eligible for Medicare, and that is, think of it of like 2 forks in a road. You have option 1, which is original Medicare, and then just an additional insurance that's going to cover that gap. Or you have option 2, which is actually Part C, and that is the Medicare Advantage route. With the Medicare Advantage route, you're not keeping your A and B, you're not keeping original Medicare. You're basically having an insurance company, a carrier, take over that Medicare, and now they are your health insurance company. So that's a replacement plan, also known as Part C, or Medicare Advantage plan. And this is why Medicare is so confusing. There's like 5 terms for like the same different insurance company. So let's talk about the different roads. In Road 1, supplement, Medicare supplement plans, you do have an additional charge, but that additional charge is covering that 20% gap. So you avoid all bills at that point. When you have a Medicare supplement plan, there's typically lots of different plans. And there's plans A all the way down to plan N. The most popular are plan G and plan N, and that's what's gonna help with that gap. What's unique about this particular scenario with a supplement plan is that you have your red, white, and blue card, the Part A and Part B. You have an additional card, which is your supplement card, likely Part G or Part N, or plan G or plan N. And then you have to get a prescription drug plan separate. Self-administered prescription drugs are not included in Medicare Part A or B. So that's something you have to get separate. So you really have 3 different cards and 3 different insurance cards you have to present when you're going to see doctors, getting prescriptions and everything. In Part C, you have Medicare Advantage. You basically now have an insurance company that's replacing your Medicare Part A and B, they are now an insurance company that has everything. Part C typically bundles everything together. You only have one card, and you do not present your red, white, and blue card anymore. You just present that one card. When you present that one card, it might even have a prescription drug plan attached to it. The other thing with that is you are part of a insurance company plan, and they typically have networks like you're used to from an employer, from PPO or HMOs. So far, we're in 3 letters: Part A, Part B, Part C. Now we're going to talk about the missing letter, Part D, and Part D stands for prescription drug plan. This is the one where most people, like somebody even like Leah, where we talked about the example earlier, failed to know that she needed a prescription drug plan. She thought it was included in her health insurance. Well, it's not. And when you have a prescription drug plan, if you never enrolled in it when you first were eligible, you'll have a lot of penalties down the road when you do enroll. The prescription drug plan, it's plain and simple. What's unique about it as well is that it's not something from the government that you enroll in. You actually have to get it directly from a health insurance company or a carrier. You're basically shopping to see which is the lower cost. You're also making sure that if you are taking prescriptions, those prescriptions are on the formulary, and they vary from prices from $0 all the way up to $100. Okay, so we untangled the Medicare maze of the 4 parts of Medicare. And now that we know this, knowing this is half the battle. Question is, which road should you take? And believe it or not, the answer falls more in line into your financial situation. I like to think of a supplement as you're paying now. And I like to think of an advantage as if you're going to pay later. In the next video, you'll see the differences between the two.